Welcome back to AM Northwest. If one of your New Year's resolutions was to lose weight, but you've already given up, you'll want to hear about Aesthetic Medicine's medically supervised weight loss plan. Here to explain more, we're happy to welcome back to AM Northwest from Aesthetic Medicine, Dr. Jerry Darm, along with one of his patients, Jeff Davis. Nice to have you here. And Dr. Darm, let's first talk about medically supervised weight loss. A lot of people think, well, I'm just going to eat less and exercise. That's all I have to do. But medically supervised programs are important.
Well, with some of our patients, there are issues, diabetes, high cholesterol, and the medications need to be changed. And especially in an aggressive program like ours, you know, a fasting program with shakes, we'll do a blood test once a month. We'll do a medical check-in once a week. So it's very, very intensely medically overseen.
You got to monitor blood levels.
Everything, everything.
Jeff, how much weight did you lose?
A little over 165 pounds.
Yeah, a little over. And that is remarkable. And before you lost the weight, what was your overall health like? Did you have some issues that you were dealing with?
Yeah, I was diagnosed pre-diabetes, which means my blood sugar was pretty high, and I had blood pressure pills I was taking, high blood pressure.
So as you were losing weight on the program at Aesthetic Medicine, they had to monitor those aspects of your health, didn't they?
Yeah.
What was the result after losing it? Because you look great.
Thanks.
I mean, it's unbelievable. Look, here's a before picture. And obviously after, you know, those issues now, blood pressure and diabetes.
Yeah, a few months later, I was off the blood pressure pills, and my blood sugar levels are normal now.
And Dr. Darm, going back to that, that's one of the issues. If somebody were to try to lose 165 pounds alone without the supervision of a doctor, they may be taking medicine they don't need.
We have to change the meds so rapidly. Sometimes our diabetic patients are off their meds within 2 weeks, so there's not time to interface with the primary care. So we need to titrate those meds very, very quickly and very aggressively in order to get them off. And the miraculous thing is we'll see sometimes even patients taking insulin that can get off within a matter of weeks.
Wow. Now, this program is there's a whole team of people involved in this, right?
The dietitians, the medical assistants, and of course the physicians who oversee the weight loss. So it's a very, very intense program. They come weekly for an hour and a half, and you know, it's a food holiday. I mean, we're using the diet shakes, and it's a 900-calorie program, basically. So the weight loss is as rapid as you can safely achieve.
When you lost weight this time, this wasn't the first time you'd tried. And I guess the point there is a lot of people try to lose weight, and they do or they gain it back, but you got to keep trying, don't you?
Yeah. Yeah, I couldn't, you know, stay at the weight I was, and the medical problems I was having, I wanted to reverse, and you know, it had happened before, and this time it happened again, and I just contacted the doc and got back on again.
How does it feel to have lost all that weight? That's a lot of weight. That's a person.
It's incredible. I feel like a different person. You know, and I think we talk about it in the program quite a bit. You kind of forget about the things that you took for granted when you were thinner or normal weight. And it's those things that you remember now and that you try to hang on to so it doesn't happen again.
After people lose weight, you continue a program.
We have
with
to
them,
do maintenance, and we do maintenance for at least a year and sometimes longer. Many patients are in the program forever because the appetite-suppressing medications that we use have to be monitored. Their condition has to be monitored. There has to be reinforcement of the things that they're doing. So, you know, some of our patients have been in the program for 10 years on a ongoing, regular basis.
The free classes after the
interesting thing with Jeff is that I've treated him for 20 years. I didn't realize this till he reminded me the other day, and he's had 3 relapses. And that's not abnormal. That's to be expected. Relapses occur, weight regain occurs, but we then retreated him each time, and he was successful each time. So the point is, don't give up. If you regain your weight, come back and do it again. And
it's a success story. Jeff, thanks so much for sharing that with us. Want to find out more about medically supervised weight loss and the other services at Aesthetic Medicine? Give them a call, 503-697-9777, and we'll have that on our website at k2.com. Good to see you. Thanks for coming
so much.
Thank you very much. We really appreciate it.